My name's Dr. Charlotte Daker. I'm a gastroenterologist with a specialist interest in neurogastroenterology and motility. What I really enjoy about the technology is the ability for it to shine light on an area that previously has lurked in the shadows and been very difficult for clinicians to access measurable, actionable answers. So a typical patient that I put forward for a gastric alimetry test is one that fulfills Rome 4 criteria for chronic nausea and vomiting syndromes or functional dyspepsia. Previously, with the previous gold standard technology, we'd have very variable and heterogeneous results that didn't particularly correlate with the patient's symptom set, and it was very difficult then to really understand how to use that result to get any patient benefit. Since introducing gastric alimetry, I've been able to reduce the number of investigations that my patients are exposed to. On patients that I'm meeting in the clinic for the first time, I'm able to stop that terrible chain of 8,000 investigations and patient who's losing faith in medical services because every time they meet someone they get another test and no one can give them any kind of indication about what's wrong. That for me is just so good, and for once I've got gastroparesis patients thanking me, which is fairly unheard of in a current or previous clinical practice. So, I feel very grateful to have this technology available to me. One of the things I love most about the Alimetry test is we have the clinician's data and we have the patient's self-reported symptom data, which is, that's their history in that moment, and that's exactly how they were feeling. And with them, I really like to be able to sit down and show them the test, show them our spectrograms and our spatial analyses, and demonstrate what they were feeling in the moment that their stomach was doing X or Y. And I found it to be super useful, as long as they can feel legitimized and understand that when the stomach does this, it generates that symptom. Gastric Alimetry has given me the opportunity to tailor medical management to my patients with a technology that's offering actionable biomarkers. It's comfortable and acceptable to the patient, it's easy to do, and it's cheap. I have saved my patients extra radiation, invasive tests, by doing this and getting clarity from an early point so that we can shape management early.